There is a massive movement happening within the longevity and aging landscape. It turns out there is much we can do to extend our lifespan and reverse the effects of aging. What we've been taught and led to believe about aging and human disease are now outdated and no longer accurate. That means it's time to change the current mainstream paradigm and have different kinds of conversations when it comes to our well-being. And it's time to recognize that we have the power within ourselves to dictate and drive our own health span and aging journey. Hi, I'm Suzaida Hippolito, host of Timeless Vitality, where we are redefining aging so we become truly timeless. It was around the age of 19 that I started toying with the idea that I wanted bigger breasts. And it was really interesting because I went back and forth in my 20s as to, okay, do I want bigger breasts or do I want to keep my breasts? Do I want bigger breasts or do I want to keep my breasts? And part of that just comes from, for me at least, the conditioning that in order to be a beautiful, sexy woman, you need bigger breasts because that's the picture that society paints in us. And then finally, at age 31, I decided I wanted breast implants. So I went for it. And late last year, I learned that my implants are inflamed and I need to have them taken out. And what I also learned that there are huge long-term implications about breast implants that we're not necessarily aware of. And it isn't until much later in life that we then start dealing with the illness and the inflammation that comes with these implants. And today, in this episode, we're going to have a very necessary conversation about implants because so many women throughout the world enhance their body this way. And we have here with us America's leading expert on breast implant illness, and his specialty is in breast explants and an advanced cosmetic procedure called non-facelift. He's been a board certified plastic surgeon for the past 16 years doing this kind of work and has performed breast explants. I'll say that again, performed breast explants in over 3,000 women and counting. I'd like to welcome Dr. Rob Whitfield. Dr. Rob, thank you so much for being here with us today.
Oh, thanks for having me.
And I'd like to just get right into this conversation and start with, start with what led you to this very specific niche of becoming a breast explant expert?
Well, for most of my career, I predominantly took care of cancer patients. So my training was general surgery for 6 years, 2 years of plastic surgery, a year of a fellowship where I just concentrated on microsurgery and performing oncologic reconstruction. So reconstruction for breast cancer, head and neck cancer, sarcomas, trauma patients, patients who had infections and had lost tissue. So that was basically training and then practice. And then in practice, the most common cancer that I would encounter would be breast cancer. So I, like a number of surgeons around the country, perform breast reconstruction. The most dominant form, or I should say most common form of breast reconstruction in the United States is going to be with ultimately a tissue expander then converted to a permanent implant, because in our country, which is extremely broad, diverse, not densely populated outside of major urban areas, community hospitals where people practice, they have to be able to provide this service, or otherwise everybody would have to come into the more urban centers to get reconstruction performed. So I performed a very specific type of reconstruction that used microsurgery. So it's basically sewing together blood vessels with suture or stitches, as people would prefer to it. That's finer than your hair. So you'd have to use a microscope to be able to see it.
Mm-hmm.
So that was the way I spared muscle and nerve, by using the tissue of the abdomen, performing what's called a DIEP, free flat breast reconstruction. So that's your own tissue.
Mm-hmm.
That was my preferred method. And I worked in a tertiary center and taught plastic surgeons how to do this in training, and did a fellowship program for them as well, so they could get more expertise. So from time to time, we would have patients come in with breast implants who had difficulties, either capsular contracture from an infection, or capsular contracture due to radiation therapy, or they just had difficulty with pain or tightness, shortness of breath. There's all sorts of things that, people would ultimately come in for, and we would convert a breast implant reconstruction to what we called an autologous, or a DIEP, free flat breast reconstruction. So that was probably my first experience with people having breast implant problems. So by volume, or the number of cases I did, because of where I worked and what I did, I never put in what you would consider a large volume of breast implants, because I couldn't. I was doing all this other work all the time. Mm-hmm. And then that basically supplanted, doing breast implant as a form of reconstruction, because, like I said, you can go out into the community, and if that was the technique you were looking for, or you're in a smaller community and that was what was offered, that represents why so many people who have breast cancer get implants, relative to what I was describing. In the cosmetic arena, that's a totally different issue. So people typically face that challenge of body image, and how they go about dealing with that is different. There's obviously other avenues. There's fat transfers for people with higher body weights and BMIs. Typically, the people who have the most body image problems are thinner people, less tissue, lower body weight, lower BMI. So then that leads them down to an implant. And in 2016, I had a breast cancer patient ask me to remove their implants and do basically a flat procedure for them. And when I removed their implants, I should preface it by, she had one problem. She had severe fatigue. And many cancer patients have severe fatigue due to chemotherapy and bone marrow suppression. So that's an unfortunate but pretty routine finding. And I did her explant, and she had no evidence of recurrent disease, but she did have an E. coli infection, which was quite surprising, because none of her laboratory analysis revealed that. She had no elevation or white blood cell count. She had nothing on her diagnostic studies or CAT scans, or any other studies that would indicate that. She had no redness or swelling or pain or anything. She just had fatigue. And after she was treated for E. coli infection, all of her fatigue went away. So I believe she put me on a Facebook group and indicated I did explant surgery. And then I just had people start calling our office requesting that. And so now, like you mentioned, I've probably done close to 3,000 explants at this point over the last, 7 years.
Wow. That's quite a journey. And it seems like it was kind of just a very happenstance thing. And I feel like today there's kind of a movement or a revolution happening with explants right now. Would you agree with that?
It's a different time. I think I have many patients who don't complain of breast implant illness symptoms, but want to come take advantage of my program that we've created for recovery after surgery. It starts pre-op with supplementation and functional medicine testing, and then we do have a detox program for patients suffering with other exposures. But I have a lot of people just don't want to have implants anymore. It doesn't fit with their lifestyle. They're trying to lead a healthier lifestyle, and they feel that's a part that obviously at one point they wanted, but now they don't.
Mm-hmm. Yeah, and that's kind of the category that I fall in. Like I've had my implants for 15 years now, and I plan to have them taken out this year. And so, when it comes to the work that you do with women and dealing with breast implant illness, what is the walk us through like how your framework for this, because I know part of your program is a holistic and accelerated recovery program, and it's part of the thing that makes your work super unique.
Yeah, it's very strategic now. It is holistic. We want to accelerate everything to get you to recover faster in our program. So we start with your genetics. So I let everybody know that, I mean, you can't outrun a bad diet and you can't pick your parents. So you have one set of genes. And although we can't change those genes, we can change the expression of those genes. So if we do a better job with how we eat. So if I have a patient who comes in who's obviously got a lot of chronic inflammation, which most of my patients do, I have pretty honest discussions with them about gluten and dairy
Mm.
and seed oils. So
Mm-hmm.
uh, I've I've gotten a lot of interesting feedback about my interest in nutrition, but
Yeah, it's
anybody
different.
who trained how I did in surgery knows all too well how to provide nutrition to patients. So that was a big part of my training. But just in general, I would say the quality of your food. There's the dirty dozen by the Environmental Working Group of fruits and vegetables that you have to pay attention to and cleanse your fruits and vegetables, get things that are organic. In terms of protein sources, I don't care what kind of protein you take in. I'm not here to promote any specific diet. I put people on high protein diets because that's what you need to heal after surgery. And so
Mm-hmm.
most people who have a Western diet or live in this country, who are educated in this country, went to school in this country, don't really understand that as a concept. And we hear all the time, the Mediterranean diet is so great. Well, I mean, basically that's a high protein diet. Let's
Mm-hmm.
not be incredibly naive about this. It's just a high protein diet. And in general, if you go to some place like Spain, where they have, obviously they're on the Mediterranean, they basically cook in olive oil and they eat either meat or fish. They don't really, a salad to them is kind of a joke. They don't
Mm-hmm.
have big salads. That's not anything they do.
Mm-hmm.
So we're kind of the weirdos who make big salads in the world and put things on them. If you ask for a salad in Spain at a nice, relatively high-end restaurant, they'll probably make a caprese thing for you that's really small
Mm-hmm.
because it's just not part of their diet.
Mm-hmm.
Um, uh, the uh, the other thing I was going to say in terms of you know just starting off simple is getting people to not cook in seed oils. And then drink
Mm-hmm.
filtered water. I
Yeah.
think everybody's relatively attuned to this, but don't drink filtered water out of a plastic bottle because it has phthalates in it, and that's disruptive
Mm-hmm.
to a woman's endocrine
Mm-hmm.
system. And then air quality. I'm a big air quality person, so air filtration, especially in where I live in Austin, Texas, there's a lot of mold, cedar, and oak in the air, and that drives a lot of allergies. So controlling your air quality is important. If you live in a place that has visible black mold, you're going to have trouble. So
Mm-hmm.
probably finding a new place or mitigating that would help you. Short of that, we test for toxic exposures of environment, heavy metals, and mycotoxins from mold. A
Mm-hmm.
gut health assessment with a GI map to make sure that somebody doesn't have a candida overgrowth, parasite overgrowth, bacterial overgrowth, leaky gut, food sensitivities, and looking at hormone balance, because most of my patients, when you look at all those things, have problems in a number of them.
Mm-hmm. Wow, that is a very holistic approach. You're literally a holistic plastic surgeon, and that is very unique. Now, I want to go back to the topic of breast implant illness. You mentioned some of the symptoms that women walk in with when
Mm-hmm.
they come to you for explant removal. Um, can you tell us more about those symptoms? If, for instance, for me, I have implants, and I imagine we're going to have quite a few women watching this who also have implants. What are some of the things that you advise we can kind of start noticing about our bodies that might suggest we have inflammation?
Yeah, I think this is what's confusing, right? So you'll
Mm.
have patients that have a laundry list of symptoms, and they'll be from every body system. So from your neurologic system, you can have headache, you can have light sensitivity and sound sensitivity, ringing in the ears. Um, you can have more kind of nerve related symptoms in your extremities. You can have burning and pain in your arms and legs. You can have vibration symptoms. The GI tract can be all
Mm.
upset.
Mm.
You know, cramping, bloating, swelling, just pain. In the, if you think about how someone breathes, someone who has implants can have a little trouble with just taking a deep breath. So they can be
Mm-hmm.
shorter breath. They can have chest tightness, of course. A lot of times I get people who feel like their heart's racing.
Mm.
And if you can think of a system, there's lots of different issues with it. But I will tell you what's a problem is those are just symptoms of chronic inflammation, and you can
Mm.
have those without implants.
Mm-hmm. Mm-hmm.
So when you have implants and you have those problems, people ask me, can you cure the, situation without taking the implant out? And I think
Mm.
everybody listening should understand that inflammation is not an easy thing to cure, especially chronic inflammation. So autoimmune diseases have been around a lot longer than implants. Implants
Mm.
started in 1962 in this country in Houston, Texas.
Mm.
So autoimmune type situations in humans have been around since the early 1900s and before that, late 1800s.
Mm-hmm.
So those are not new. Implants entering the equation is new. So if you go back to what I said initially, is we look at genetics. So people who don't detox well and people who have a
Mm.
lot of exposures concordantly and maybe not eat well and have gut health issues, lots of sensitivities and hormone issues, those people will be more susceptible to the symptoms I'm describing.
Mm-hmm.
And, breast implant illness to me is just chronic inflammation.
Okay.
Unfortunately, you have an implant and that plays a role in that chronic inflammation because any
Mm-hmm.
foreign body, hip, knee, breast implant, cardiac implant, dental implant, neurologic implant for, your spine or something like that can contribute to inflammation because it's a
Okay.
foreign body.
Okay. Yeah, and I want to touch on that some more. Putting something foreign in your body. What are we doing to our body when we do put something foreign in it? Because I think we're not really truly educated on what that means, right? Like, what are the implications to this human physique that we've been endowed with when we are putting breast implants, for example, in our body? What do we need to understand more about that?
Well, probably the easiest way to think about it is the first kidney transplant was done on Siamese twins. So a Siamese twin is the exact genetic, copy of the other. That's why they're
Mm-hmm.
called Siamese twins. So you
Mm-hmm.
can take the kidney out of one and put in the other, and it'll be
Mm-hmm.
fine because it's the exact same genetic makeup. Now, that means you don't need any drugs to block what is called your immune response. So if you change that to a cadaver kidney, so if you gave me your kidney because I was in renal failure, they
Mm-hmm.
would have to give me drugs to block my immune response to that kidney.
Mm. Okay.
So when you put a breast implant, hip implant, knee implant in anybody, you're going to have an immune response and your body's going to form a scar around it because it wants it out of your body.
Yeah, what do you mean by an immune response?
Yeah, it's going to form a scar around it. So
Okay.
your body's natural way is to wall it off, create a,
Okay.
a box around it or whatever you want to think of it. And that's your body's scarring it off.
Hmm.
And
So
when you take these,
is that the body like protecting itself from this foreign object in a sense, or this
yeah,
foreign
your body's
substance?
trying to get
Okay.
it out.
Okay. Got
Yeah,
it.
if it was a kidney transplant, like I said, your body would attack it and kill it
Okay.
because it's not
Interesting.
yours.
All right.
It can't attack and kill an implant because an implant's not alive. It has no
Mm-hmm.
blood supply. So your body tries to wall it off. It creates a scar around it because your body realizes it doesn't belong there.
Okay. Got it. So with the body then, okay, if we're putting breast implants in our bodies, so our bodies create scarring around it to wall it off. And if you're living with that implant for years and years on end, in some cases, like 10 years, 20 years, 30 years, I want to just kind of presence, then does that mean some of the ways that the body would react, like you're saying, is with inflammation? So we're kind of propagating that inflammation because we have this foreign thing in our body. Is that what I'm hearing?
So about a third of the time, you can get a bacterial component that clings to an implant, whether it's a hip, breast, knee implant, doesn't matter. It's a foreign body. So say you had a skin infection and it gets into your bloodstream. Say it gets infected. So that would end up contaminating an implant potentially because it's an implant, like I said, doesn't have a blood supply. So it can stick to the surface of the implant. Now those bacteria, some of them in particular, create what's called biofilm. And think of it like a sticky coat. Bacteria stick together and make a little coat that stimulates your immune system.
Got
then
it.
you have more immune system activation and more immune system it continually activates your immune system.
Got it.
There are papers published about this now, and basically, whether it's a hip, knee, breast implant, these types of bacteria that produce biofilm can produce a more enhanced immune response because they're all going to create a response in general. But these ones that have a bacterial component stuck to them in a biofilm can really stimulate you even more. And we feel like that's a real reason why people become more symptomatic.
Got it. Now, if somebody wanted to check on the extent that their current implants might be causing inflammation in their body, where can they go? Because you're in Austin, Texas, but where can they go and what kind of tests should they talk to their doctor about?
Yeah, there's no definitive test, exam, or anything you can do as it currently stands to understand this as kind of the way we look at it now. So having seen all these patients and reviewed their genetics and other toxicity testing and gut health testing and food sensitivity testing and hormone testing, you see all the things that are off and you understand them from a genetic standpoint. So the things that we try to do, if someone's decided, like you said, you're going to get your implants out this year. So I have a lot of people who have come to the conclusion that, this is no longer consistent with their path. They don't want this anymore and they're going to change. And I have people who can't come here to Austin, even though I have myself and other surgeons available. They're going to run our program independently. So my detox program can be ran remote. Our testing program can be ran remote. And our supplementation just for inflammation can be done remotely. So those things are all so people can take advantage of the program without having to have surgery here and go through the logistics, because that is complicated to come and stay. I typically have people here from out of state for a week. If they're out of the country, I have several clients from Europe. They'll stay here for 2 to 3 weeks just because the flights and the length of time traveling is complicated for them. I recently had several patients from Hawaii, and they had a difficult time just getting back. They had really long layovers and things. So you want to obviously get everybody taken care of as efficiently as possible. And our programs are scalable to help that remotely.
Okay, got it. I'm so glad to know that because we'll put Dr. Rob's um, info in the show notes so that you all can link to the testing, the plan, and will make it accessible to you. Now, when what is the alternative for women who still want to have breast implants and not do so with saline or silicone? Because I know you work also with the body's fat stores as part of breast reconstruction. So, is
Sure.
what's the alternative?
Yeah, I mean, when we do explants, we do a lot of fat transfers simultaneously. And
Mm-hmm.
obviously, that's to offset the change. And nobody, you know, comes to me and says, I want to be, super flat again or anything like that. So we're always trying to
Mm-hmm.
find the best solution. Obviously, people who are lower body weights, lower fat, stores are harder to take care of because they just don't have a lot. Um, and for everybody listening, I don't, I'll be pretty candid about it. So if you have trouble putting on weight and maintaining body fat and work out a lot and cycle or run or do whatever, Peloton, spin, whatever it is, it's probably in your best interest to start thinking and change your mindset about what you should be doing if you want a fat transfer to enhance your breast, because everything I just mentioned before that is not really compatible with a fat transfer. So for women in general, you want to avoid osteopenia, which leads to osteoporosis. So you need to, participate in resistance training. And no, you're not going to lift weights and look like a bodybuilder. It's not possible. But it's going to be great for your bone structure. And you can eat healthy fats, avocados, certain, seeds, nuts. You can get healthy fats in your diet. I have a patient who specifically, I think she was telling me she was trying to eat a pound of almond butter a week just so she'd have enough fat so I could do a fat
Mm.
transfer. But the the kind of mindset shift that has to happen is people work out because they get dopamine, like you're addicted to
Mm.
dopamine. So
Mm.
I don't think anybody should be confused. They like running and getting high, and they like, doing things because of the feeling it gives them, which is
Yeah.
fine. But you can't come ask me or another provider like me to give a fat transfer and get it to last if that's going to be your behavior. So the first thing is just change how you
Mm.
think about it. So we're obviously all wanting to help, but to do a fat transfer, you need a couple things. You need to have the right frame of mind. You need to be having the right diet, right exercise program, so that you can maintain it over time. And that means, you're going to have to get your hormones checked. You're going to have to keep that in line. You can't, like I said, go do all these HIT and F45 and Orange Theory and Peloton and cycling and spin and all this stuff because it makes no sense.
Mm-hmm.
It's not compatible with that.
Mm-hmm. Yeah, I think that's really important to present. It's where is your mindset at about this? And I also feel like there's this whole idea that as women, and I don't know, Dr. Rob, you may or may not have any comments about this, but I feel like as women, we're coming into this time in our existence where let's just start accepting ourselves and our bodies for exactly as they are. And I think also it's important to recognize what's the intention, like where is it coming from. Oftentimes many women get implants because of body image issues. So I'm curious, Dr. Rob, do you have anything to say about that topic?
I mean, sure. I mean, body image has been the problem the whole time. It's not anything new. So whether it's not any easier for women these days. There's
Mm,
between the phones that are constantly up someone's face all the time,
mm,
whether, starting at what age now?
yeah. Oh my gosh. Three?
And so you haven't got an easier problem. You now have a harder problem to deal with.
Yeah.
So people are
Yeah.
bombarded with images all the time. And, it's, I get asked, what would I say to my daughter if she came to me and said, I want breast implants? And so, first of all,
Good
for everybody
question.
listening, my daughter's a Leo. She's like me, and you're not going to tell a Leo anything. So all you can do is try to educate so that somebody can make an informed decision. So I don't sit here and tell anybody they need a breast implant or they need an explant. I don't have to do that at all. I'm old enough now that people come to me and ask me for things like advice. I give them my opinion and they make a decision. You just want the person on the other end of that to have the most information to make the most educated and informed decision. That's all we should ever try to do. I'm not going to resolve anybody's conflict about body image, implants, or explants.
And what is some of the advice that you give?
Yeah. So if someone comes in and they want a fat transfer, it's more about their body composition, their lifestyle, diet, maintenance, especially a young person. It's really hard to tell a young person anything because they have very little life experience. So I always took care of cancer patients. So my attitude towards things was very specific to deal with a patient. The youngest cancer patient I ever had was 24. Pretty bad diagnosis at 24 to have is breast cancer. Yeah. So I have a very different perspective on taking care of patients and having those discussions. They're all very serious discussions right from the start. So if you're going to have a patient at 24 with breast cancer and they're going to have a mastectomy, that's a pretty big thing to discuss with a patient. Yeah. So, and I'm not discounting anything. It's just a very complicated discussion to have regarding, if someone that age is going to get adjuvant therapy, chemotherapy, radiation therapy, surgery, reconstruction, how's that look? How long is that going to last? So my conversations were always pretty long about, what we're doing, why we're doing it, and what's the expectation. So none of those are easy. None of them are fast. And you just want to give patients the best amount of information. And it's, in those settings, you're basically drinking out of a fire hose when someone tells you that stuff. So I was usually the last person to talk to that patient in a string of providers who had already given them some really bad news.
Yeah.
So many times I had people, I would have conversations with them and you could just tell that they had had enough that whole whatever week it was. They had been told all this information and I was the last person. Typically on a Friday afternoon, my clinic where I used to work would be on a Friday afternoon and I'd see these poor folks and it'd be a very difficult, hour to spend with them. And most of them probably didn't get much of what I was saying because it had been such a difficult time for them.
Yeah. Yeah. I mean, their mindset was probably just clouded in the fear of, I don't have many options, but you were introducing them to a different way. Like, here's actually another possibility for you. And it sounds to me like that's the space that you were holding for people. And it also sounds to me, Dr. Rob, that you have very empowering conversations with women. As you say, you give them the information and you ask questions and you take the time to really help them understand what they need to know and what they're seeking through you. So thank you for that work. And I like to ask all my speakers 3 questions as we wrap our interview. And the first question is this: since we are talking about reverse aging and promoting human longevity, what is your number 1 life hack for promoting your own longevity?
Oh, the quest for sleep.
Sleep. That is.
Yeah, if you can't sleep, you can't recover. You'll wake up feeling as poor as you did when you went to bed. So simple things to do are the 3-2-1. So stop eating 3 hours before bed, stop drinking 2 hours before bed, get off your phone an hour before bed, and have a routine. temperature needs to drop a little bit for bed.
Mm-hmm.
You know, if you've got a problem with breathing, you know, wear something to help you. If you wake up easily, you know, wear some sleep earphones or something. You got to get
Mm-hmm.
rest. If you don't, you can't recover, and then you're useless.
Mm-hmm. Got it. Thanks for sharing that. And that reminds me, there was one thing that I completely forgot to ask you and kind of tie back to the reason why we're here today. What is the link that you see with breast implant illness and aging and potentially reverse aging effects?
If you just think globally about aging as inflammation, you want to do everything you can to reduce inflammation.
Mm-hmm.
So people will die due to end organ damage. And I mentioned kidney. So obviously we have kidney transplants because people get kidney disease.
Mm-hmm.
A drug like Ozempic and Wegovy and Mounjaro, those are all going to change kidney disease because they're going to prevent people from having as many problems with diabetes.
Mm-hmm.
So diabetes is a leading cause of kidney failure. So that will go down. You already see people, because those drugs all change behavior. They prevent
Mm-hmm.
people from wanting to binge eat. So you'll see people eating less fast food. You'll see less kidney disease. You'll see, by virtue of that, things like hypertension will go down because they're not eating as much. They're not weighing as much.
Mm-hmm.
The kind of problems with liver and lung and heart, you know, you would like to see people drop their, you know, heart attack, stroke risk. So anything that drops inflammation will do that. Now, if you consider implant of any variety something that promotes inflammation, then you're enhancing aging. Now, some of it we can't avoid. So if somebody has just got such a bad knee or a bad hip that they can't walk, then
Mm-hmm.
obviously they get a replacement. And, you know, when we're trying to do, you know, reverse engineer this and say, all right, how do we prolong our lifespans? What do we have to do? Well, you have to eat better, sleep better, take in higher quality fluids, and breathe better air. And that will
Mm-hmm.
reduce your inflammation. Now, supplementation, you can do things to drop inflammation as well by supporting your immune pathways. But it all starts with what you put in your mouth.
Mm-hmm. Yeah, and thank you for making that connection and ultimately tying it back to inflammation. So if we can minimize all of that, it will help promote
Yeah.
a healthier lifespan and potentially reverse some of the effects of aging. So thank you for tying it back. Now, the second question I ask all my speakers is, where do you see the future of longevity, human longevity headed?
It's always going to be about hacking genes. Everything's
Mm-hmm.
a genetic code. So the more they learn about that and can reverse engineer either supplements or some kind of, you know, modification to, just like I mentioned, the GLP-1 inhibitors, that's going to reduce, you know, the amount of people going, say, on to, like I said, dialysis or going on to have heart attack or stroke, or like all these things will have long-term ramifications as it, you know, as you look at aging. Like in the people who live the longest live in Japan. So they're like
Mm-hmm.
88.
Mm-hmm. Mm-hmm.
In the Western countries, like our country, we're basically at 80. So we're 8 years less. And so why? So typically their diet's higher in omega-3s because they're basically surrounded by water.
Mm-hmm.
So if you're trying to, you know, work it backwards, like how are you going to get that better? So one is, like I said, they're going to modify behavior with, you know, part of it's going to be drug, but the more you can do genetically to enhance or promote your immunity, decrease inflammation, that'll prolong longevity.
Got it. All boils down to those genes. The third question is, what is a thought or act that takes you back to a childlike, playful state?
Oh, that's a good question. A thought or an act? Oh, gosh. probably see in my kids, your kids, you just want them to grow up and be, have high character, be accountable, and you try to give them lessons. I don't think, trying to, I guess having a teenage daughter is very interesting. I'm trying to relate to things that, when I was younger, and I was like, man, my son was easy because I was like, oh, it's a boy. We kind of fall back on your memories, and it's a little bit simpler. But for my daughter, I'm just like, she's a lot like me. So from a mental perspective, I can gather it because she's a Leo like me. But some of the stuff, wow, I don't envy being a girl. Not at all.
Thank you. I appreciate that. And yeah, it has its challenges, that's for sure. Well, and that's why we have incredible people like you and experts like you helping us kind of course correct when we get to that stage in our life about our bodies, as you say, that it's like, okay, this isn't an alignment anymore. So thank you for being a modality for us, for being a guide. And there's so much that we covered here. And I know that you have a lot of resources to further the dialogue on this and increase the knowledge and awareness. Where can we get more of that information?
Yeah, I feel like we've really tried to create educational content via my podcast, The Breast Implant Illness Podcast with Dr. Robert Whitfield. We have a YouTube channel, Breast Implant Illness Expert. We have an IG handle, Breast Implant Illness Expert. We have our URL, breastimplantillnessexpert.com. So all the things are geared to help you. And so these are not decisions that you make rapidly. You need to go through your own process of learning. I've tried to filter it down to make it simple. I've appeared on a lot of other shows, just like I've appeared on this one. And I think the more you can learn, the better you can make decisions. And first things first is just start with your mindset. Wake up, give yourself a little gratitude, have a positive mindset. Be careful with what you eat, drink, and breathe.
There you go. Taking it back to the basics, And any parting words for our audience? Oh, by the way, we'll put all those links in the show notes. Any parting words for our audience, Dr. Rob?
Yeah, just try to get some sleep. Good sleep.
Yeah. Speaking of, absolutely. I'm all for that. Well, thank you so much for being with us today and this very necessary conversation and just walking us through understanding our bodies more and really connecting with the implications of this organ, our breasts, that makes us unique as women. So there we have it. Thank you.
Thanks for having me.